Sir, am I good to go?
Just a minute. Just give me 30 more seconds.
Yes. I'm starting.
Just a minute. It is loading. CK. அதான் எனக்கு புரியல. ஏன் அப்டேட் ஆகுதுன்னு தெரியல. விசிபோர்ட்டுக்கு அந்த பக்கம் தான் எடுத்துருக்கோம், கரெக்டாக எடுத்துருக்கோம். சரி, அப்போ சரி ஸ்டார்ட் சொல்லுவோம். எங்கே இருக்கு அந்த இது நம்மளுடைய இது அந்த ஜூம் எங்கே இருக்குங்க? இதானே? Yes, doctor. Yeah, Nishant, please start. We are online.
Good evening, participants and all the colleagues. So, thank you for joining for today's webinar. And today, the topic is on vaginal microbiomes in women's health. And our special guest speaker for today is Dr.Lalit. So before I start with the intro, let me give a short view about our digital page Shield Connect. So this is the page shieldconnect.in. When you log in, you can see this page. There are various sections in this pages. So the first is the blog, where you can see various blogs written about different disease and disorders and various issues related to in COVID. And it is written by our eminent doctors. Then there is a webinar section where you can find all the upcoming webinars as well as the past webinars. So in the upcoming webinars, like you can see, when you click on the today's webinar, you can see the today's webinar, vaginal microbiome women's health, and you can see the live video. Now there is one more section, awareness section. In awareness section, there is two pages, immune booster and PCOS awareness page. So the first page is immune booster, where we have reintroduced our new product, Glutidin New, which is acting as a respiratory immune booster in this pandemic situation. Then the second page is regarding the PCOS awareness page, where you can find all the details regarding the PCOS by various doctors in various different languages, that is Tamil, Hindi, Malayalam, Telugu, English. Then there is one more page, our leaders, where you can find all the eminent doctors who are linked with our page. This is the key opinion leader page, where you can see all the listed doctors who are connected with the Shield Connect. Then there is a special page section like Hypertension Day, Mother's Day, GDM Special Day. So let me share any one page where you can see Hypertension Day, where you can see various blogs regarding the hypertension related videos. And this is our page. So let me start with the quick intro of our special speaker, Dr. Lalit Bora. Sir is a senior consultant in obstetric and gynecology, and sir is a retired joint director of health service in Shivsagar, Assam. So before I hand over the webinar to sir, there is a comment section in our page. You can post your queries to participants so we can have a Q&A session at the end. So let me stop sharing my screen and I hand over this session to Dr. Lalit Bora. We welcome you, Dr. Lalit Bora. We are glad to have you on this platform. So I hand over this session to you.
Okay, thanks for your nice words. Okay, good evening, everybody. It's my proud privilege to be here in this webinar that is dealt with vaginal microbiomes, rethinking health and disease of the woman. So I welcome all my senior and junior colleagues and ladies and gentlemen. It's a very simple subject, but as well as it's very important one that you come across in our day-to-day practice. Whether it's a general practitioner, it's a gynecologist, obstetrician, or an ART expert, it is having the same importance to everybody.
So the screen is visible.
Yeah, I'm doing it.
Yes.
So before going into the main subject, we must know what microbiota is. In a very simple words, I would like to explain microbiota are the microorganisms that present in our body in the multicellular spaces, and it is very much specific to different organs like oral, skin, gut, or vagina. There are two types of microorganisms present in our body. They are called good one and bad one. Good one protects our different organs from different diseases, but the bad one that we call the pathogens, they create disease processes when they take the upper hand from our common cell or good microorganisms. The good microorganisms keep bad or pathogenic organisms under control. And to be too specific, microbiota are ecological communities of commensal, symbiotic, and pathogenic organisms found in and on multicellular organisms. So these microorganisms, they are specific for different organs that is present in our body, whether it's a conjunctiva, mouth and oropharynx, gut, skin, urethra, vagina, stomach, ear, nose, and so on. So today we'll be dealing with the normal microbiota of the vagina that we can see in the slide. The lactobacillus, streptococcus, diphtheroids, streptococci of various types, bacteroids, candida, gardnerella vaginalis, and clostridium. So for the all practical purposes, we divide our reproductive system in the upper reproductive system and lower reproductive system. In the lower reproductive system, we include cervix, a part of cervix, and vagina. Escherichia coli and anaerobes predominate in childhood. that is a strain of 55 and 57. Lactobacillus colonization begins in puberty and decreases after menopause. These are the 52, 53, 55, and 57. Enteric and anaerobic bacteria are codominant in postmenopausal ages like 75, 77, 81 to 88. In upper reproductive system, that includes the uterus, the fallopian tubes, and the two ovaries. So they are the Lactobacillus 13, 17, 62 are predominant. Firmicutes, Bacteroidetes, Proteobacteria, and Actinobacteria are the main. This is of 14 and 25 species. Now, what are the main factors that modify our vaginal microbiota? The specific condition in this factors for modifying vaginal microbiota are age. Starting from the newborn up to the childhood, there is less activity of the ovaries in a woman's body, so there is low estrogen and the glycogen level are low. That is why there is thin vaginal epithelium. There is low lactobacillus and there is high pH level. In the adult woman, high estrogen that gives the increased number of glycogen. So there is thick vaginal epithelium and high lactobacillus, and there is low pH. Postmenopausal age group, there is low estrogen and glycogen, thin and disrupted vaginal epithelium, there is low lactobacillus and high pH. During pregnancy, there is lower concentration of mycoplasma and ureaplasma, decrement in pH, increment in vaginal secretion. Then there is the factor of infections. There is aerobic vaginitis and there is bacterial vaginosis. In aerobic vaginitis, lactobacillary microflora disturb. pH level is 6 to 7, yellowish discharges there, Staphylococcus aureus and Escherichia coli are the prevalent organisms. And bacterial vaginosis, lactobacillary microflora disturbances there, pH is more than 4.5, white gray discharge, inflammatory changes, Gardnerella vaginalis and Mobiluncus species are the prevalent organisms. There are other factors which modify vaginal microbiota. These include ethnic group. In ethnic group, changes in pH level that is always towards the high level, lactobacillus colonization depending on the ethnic group. Smoking and smoking plays an important role for the modifying vaginal microbiota. There is low estrogen level, prevalence of BPDE in the vaginal secretions, decrement in the lactobacillus concentration, and the women, those who are suffering from cancer, there is deplete of lactobacillus and high diversity of microorganisms. So we can divide our women in before puberty, during puberty, and reproductive age, and post-menopause. What we see here before puberty, there is no very less amount of follicular development from the ovary. So estrogen silence is there. Due to the estrogen silence, thin vaginal epithelium and mucosal layer, there is less production of glycogen, so less lactobacillus growth. Secretion of diverse microbiota is there, alkaline pH and diverse VMB. During puberty and reproductive system, there is follicular development which gives rise to estrogen production. So there is Intracellular glycogen is there, glycogen shedding occurs, glycogen breakdown by alpha amylase, and fermentation of breakdown products, selection of lactobacillus and acidic pH and lactobacilli dominance occurs during puberty and reproductive age. In the postmenopausal age, this is something like before puberty, the follicular depletion is there, ovaries stop secreting estrogen, thinning of the vaginal wall and dryness of vagina is there, which is the main complaint of postmenopausal women. Low glycogen production, low lactobacillus growth. There is secretion of diverse microbiota, alkaline pH, and diverse VMB. In normal vaginal flora, we can divide the groups into newborn and up to 6 weeks, pre-puberty and puberty and menopause. In newborn up to 6 weeks, there is acidic pH of vagina. Lactobacilli are there. Along with the lactobacilli, as epididymis, streptococci, enterococci, enterobacteriaceae are there. In pre-puberty, pH is normal, as epididymis, streptococci, enterococci, enterobacteriaceae are there. Along with this, there are the Gardnerella, mycoplasma, and ureaplasma. Puberty pH level is acidic, lactobacilli are there. All other as epidermis, streptococci, enterococci, enterobacteriaceae are there. Along with it, sorry, Gardnerella, mycoplasma, and ureaplasma are there. The menopause, it is something like your newborn or the prepubertal stage. pH is neutral as epididymis, streptococci, enterococci, enterobacteriaceae, along with Gardnerella, mycoplasma, ureaplasma, mobilum cast, and along with the candida are present. There is a healthy vaginal ecosystem and there is an equilibrium. It includes the vaginal epithelium, normal colonization of the organism, mostly the lactobacilli. Local secretory and cellular immune factors are also there. The vaginal pH maintained in between 3.8 to 4.2, which is acidic, creates, and all these factors, mainly the acidic pH of vagina, it creates unfavorable environment for pathogens to create some disease processes. Normal vaginal flora, mainly the lactobacilli, these are gram-positive rods excrete hydrogen peroxide present in 100% of the women with normal flora, affects adherence of epithelial cells, protect against bacteria or candidal infection. Normal vaginal flora, which is having the protective role, there is increased estrogen, epithelial glycogen is there, lactobacilli in presence of it acts on the glycogen and it forms lactic acid, which gives the vaginal pH in the acidic form. Lactic acid maintains acid pH. There might be abnormal pH because of the trauma, low estrogen, menstrual circulation, alkaline seminal fluid, alters vaginal ecosystem that can cause epithelial desquamation. And there is it is towards the alkalinity of the vaginal pH, it is over 4.2. On the left hand side, you can see the vaginal epithelium, the estrogen, the glycogen, lactobacilli, it acts and gives hydrogen peroxide and lactic acid. Facultative organisms are diphtheroids, coagulase negative, streptococci, Escherichia coli, ureaplasma, urelitium, mycoplasma hominis. So as we have already mentioned, the ethnicity of a woman plays a role in vaginal microbial composition. Helias, he has conducted uh, experiments in 100 women, major ethnic group in Amsterdam, and he has found that bacterial vaginosis is 2 times prevalent in the community they are coming from the African origin compared with the white skinned women. He has conducted this series of experiments. Total population was 546. He included Dutch, South Indian Surinamese, African Surinamese, Ghanaian, Turkish, and Moroccan. Lactobacillus dominance and low vaginal pH unique to humans. When we compare human beings with the apes or yellow baboons, olive baboons, chimpanzee, Lenur, and so on, then we can see that only the human vaginal pH is 3.5 or something in the acidic group. Vaginal pH of the baboon is in between 6 to 8. So lactic acid and low pH creates a strong antimicrobial environment permissive to lactobacillus colonization. So what we can assume from this, the lactic acid is predominantly produced by vaginal bacteria. So we have known that in vaginal microbiota, there are beneficial and pathogenic microbiota are there. Beneficial are lactobacillus 6 specific strains and bifidobacterium is there. In pathogenic group, Gardnerella and Etopobium. So the Nesser's selection is like that. Though there are harmful bacteria and good bacteria in the human vagina, there is a equilibrium or homeostasis or balance of these two. When there is a imbalance in these two bad and good microorganisms, there develops the different complaints of the woman and the disease process. So how can you diagnose the ailment from the various complaint of the woman who comes to our clinic? There are two main criteria for diagnosis. One is AMSEL'S criteria and another one is NUGENT'S scoring system. Third one is also there. AMSEL'S criteria that was developed in 1983. This criteria diagnosed bacterial vaginosis by these 4 symptoms: thin, grayish, quite homogeneous discharge, which we usually get from our patients as their main complaint. Then there is pH level is high, more than 4.5. 10% potassium hydroxide addition on vaginal discharge produces fishy odor. Clue cells are there. Clue cells determination with wet mount microscopy. The precision accuracy of this AMSEL'S criteria is only 83%, and there are certain limitations of AMSEL'S criteria also. As you can see, semen presence results in positive potassium hydroxide test and increase in vaginal pH. During dosing, pre and post menstrual cycle, and intercourse vaginal secretions behave as bacterial vaginosis discharge. Candida and trichomoniasis secretions may give same appearance as bacterial vaginosis. Clue cells presence may be due to degenerative cells or debris. Another a bit precision accuracy is 89% in NUGENT'S scoring system. Bacterial strains are assumed large gram positive rods, small gram variable rods, variable coccobacilli, disappearance of lactobacillus, appearance of strict anaerobes. All these things, they give certain scoring, and we can see the scoring in the organism, from the organism morphology also, gram-positive bacilli, then small gram variable rods, small gram-negative rods, and small variable coccobacilli. Carved gram variable rods, gram-negative rods, and strict anaerobes, they give you 7 to 10% of scoring. Other methods are also there: rapid nucleic acid hybridization test, proline amino peptidase activity, polymer same reaction, or PCR, sensorary combinations of microbial products. So to maintain the vaginal hemostasis, there are beneficial microorganisms like lactobacillus is there. Lactobacilli produce lactic acid and maintain vaginal pH in between 3.8 to 4.5. Lactobacillus also produce hydrogen peroxide, which is a bacteriocins, prevents bacterial growth. Lactobacillus does not allow attaching of bad bacteria to the wall of the vagina by competitive inhibition. So certain factors which influence the vaginal microbiota. Many times we have come across all these points. So vaginal epithelial structures as well as the microbiota change considerably from childhood to the menopause that we have already discussed. During menstruation, what we notice that non-lactobacillus species appear to increase in number in the vaginal fluid, while the lactobacilli decrease or stay approximately the same. But during pregnancy, lactobacillus dominant microbiota is strengthened by the increased estrogen level, but at the same time, vulvovaginal candidiasis increases compared to non-pregnant women. During menopause, prevalence of lactobacilli becomes less due to the low estrogen level, and there is high vaginal pH, is in high vaginal pH. Thus, estrogen has a decisive effect. We can come to a conclusion that on the composition of the lower genital tract, estrogen plays an important role along with the lactobacillus. What are the factors that are associated with vaginal dysbiosis? Composition of vaginal microbiota and vaginal pH is influenced by the host demographic state like ethnicity and age of the patient. There is host genetics, behavioral characteristics like sexual activity, smoking and hygiene activities, environmental characteristics like healthcare provider actions, because they used to give the women the lubricant used and antibiotic administration, which are harmful for the women, as well as there is increased number of women who are suffering from the bacterial vaginosis. This is a very good slide. A dynamics of vaginal microbiome in response to female sex hormones. The vaginal epithelium in presence of progesterone and estrogen, they increase in their thickness. So there is glycogen deposit in the epithelial cells, and the surface epithelium give rise to the flake out cells lysis, and which releases the estrogen. Glycogen. Glycogen is a nutrient source for the vaginal microbes, and the lactobacilli and other microbes, they produce lactic acid, and hydrogen peroxide is released by the lactobacillus, which inhibit the growth of the other pathogens. In this slide, you can see the abnormal vaginal microbiota. There is lactic acid producing lactobacillus is less. High proportion of facultative organisms, that is Gardnerella vaginalis, and strict anaerobes are there. pH level is high, more than 4.5. And we can see the NUGENT'S score from 0 to 3, 4 to 6, and 7 to 10, which gives the bacterial vaginosis. And in the normal vaginal flora, the NUGENT'S score is 3, 0 to 3, NUGENT'S score 4 to 6 in intermediate flora, and NUGENT'S score is 7 to 10 in bacterial vaginosis. In this slide, you can see a beautiful woman who is very saddened by her ailments, because the altered vaginal microflora leads to urogenital problems. She might be having vulvovaginal candidiasis, bacterial vaginosis, urinary tract infection, or pelvic inflammatory diseases. Then if you see the causes of vaginosis, the most common cause is the bacterial vaginosis is 40 to 50% of all the cases. Vulvovaginal candidiasis is 20 to 25% of cases, trichomoniasis 15 to 20 cases, and non-infectious causes are 5 to 10%. And we have discussed the matter that the bacterial vaginosis is caused by the imbalance in vaginal homeostasis. Around 30% of the women, they suffer from the vaginal discharge. There is pain, there is foul smelling, but they do not like to reveal many a times. And around 30% of the women, they suffer silently from the disease. Bacterial vaginosis is a serious burden to women of reproductive age group. Then what are the risk factors for bacterial vaginosis? The vagina is not a steady state of ecosystem that we know. There are menstruation, estrogen protectiveness, then race and ethnicity. Ethnicity is there, black women at higher risk. Frequency and kind of intercourse, new male sexual partner, more male sexual partner, female sexual partner. Sexual intercourse once a week was the only risk factor associated with bacterial vaginosis, and production of hydrogen peroxide and by the lactobacillus. So bacterial vaginosis is sexually transmitted diseases or a raise of pH level of vagina. That's a question. Then what might be the sequelae of bacterial vaginosis or urinary tract infection? There is increased chances of HSV2 infection, HIV shedding. There might be perinatal mother to child HIV transmission, increased sexual HIV transmission, susceptibility of HIV infection, infection with CT and HPV, early loss after in vitro fertilization, associated with recurrent UTI, associated with pelvic inflammatory disease, and postpartum endometritis. Here we can see the normal lactobacillus, then Gardnerella vaginalis and anaerobes. So Gardnerella vaginalis or anaerobes, if they are more in the vagina, then there is bacterial vaginosis, and which produces the symptom. And lactobacillus becomes less, and the pH of vagina, it increases from 5 to 6. So in this slide, you can see absence of vaginal lactobacillus, that is bacterial vaginosis, on the right-hand side. And on the left-hand side of the slide, you can see the NUGENT score is 0. Lactobacillus dominated microbiome, gram-positive rod-shaped bacteria, pH level is less than 4, high lactate concentration up to 150 millimole. On the bacterial vaginosis, often asymptomatic overgrowth of gram-negative or variable anaerobic bacteria, Gardnerella or Etopobium, PREBIOTIcs, SEQUELAE, and so on. And there might be symptoms like odor, thin vaginal secretions, pH level is more than 4.5 and exfoliated epithelial cells, or these are called clue cells. Now, what might be a woman come to us with the symptoms? They might come with the itching of vagina. There might be discharge, which may be thick or thin, or white or yellow in color. There might be bad odor. Burning sensation might be there, which gets work during micturition or during intercourse. There might be dyspareunia and dysuria. Pain and discomfort will be there. So how can you diagnose? How can you diagnose the condition? Gram staining of discharge, pap smear. We can do the culture, pH of discharge, potassium hydroxide 10% solution, that is called whiff test. Then diagnostic, we do have diagnostic kits also. We can diagnose by AMSEL'S criteria: thin, white, homogeneous discharge, vaginal pH greater than 4.5, detection of clue cells in vaginal wet smear, presence of amino odor with addition of 10% potassium hydroxide to vaginal discharge on a glass slide, and it is called the positive whiff test. Or we can go for the NUGENT'S scoring that we can see here, scoring based on morphotypes per high power field. That is 0, less than 1, or 1, 2 plus, 1 to 4, 3 plus, 5 to 30, 4 plus, equal to or more than 30. Total score is 0, 3. Normal 4 to 6, intermediate 7 to 10 is bacterial vaginosis. That you can see on the left-hand side of our slide. There is other method like grade 1, normal lactobacillus predominate, grade 2, intermediate lactobacillus seen with the presence of Gardnerella or Mobiluncus, grade 3 bacterial vaginosis, lactobacilli absent or markedly reduced with predominance of Gardnerella and or Mobiluncus. So this criteria is Hay or Ishon criteria. If a woman they suffer from vaginosis, what might be the consequences of that woman? There is increased susceptibility of sexually transmitted diseases. There might be preterm labor, infertility, failure of embryo implantation in IVF. That is why I have told in my earlier my talk that it is also concerned, very much concerned with the doctors who are dealing with the IVF. Recurrent pregnancy loss might be there, or there is risk of cancer. So on the treatment part of view, what I would like to emphasize, in our early days, when we were beginner or when we were in our college days, that time the treatment schedule was something different from today's treatment schedule. So in the period of 70s and 80s, the treatment schedule was something like this. Still it is prevailing also. Treatment guidelines for bacterial vaginosis. Recommended treatment is metronidazole 500 milligram orally twice a day for 7 days. Metronidazole 0.75% gel, 1 applicator, 5 gram intravaginally once a day for 5 days. Or you can use clindamycin 2% cream also. 1 applicator that contains 5 gram intravaginally, that should be given at bedtime for 7 days. Alternative treatment is also there with tinidazole. Tinidazole you can give 2 gram orally once a day for 2 days. Tinidazole 1 gram orally once a day for 5 days. Clindamycin 300 milligram orally twice a day for 7 days. And clindamycin ovule that is given intravaginally at bedtime for 3 days, and the dose is 100 milligram per day. And this is the guideline that we get from Disease Control Center for Disease Control and Prevention. Recommended regime pregnancy. I would not like to say much about this. So screening and treatment in asymptomatic patients. It is said that screening is not recommended for asymptomatic patients. A sexual partner may change the vaginal flora. Female partners of women with bacterial vaginosis should be examined and treated if bacterial vaginosis is present. If both the partners are not treated at the same time, the recurrence is much more high. Do not need to treat the male parents partner because they do not get the bacterial vaginosis and they do not transmit it. Screen and treat prior to surgical abortion or hysterectomy. So those who are doing the surgical abortion or doing the hysterectomy operations, it's very essential to go for the counseling of the patient and screening of the patient before surgical abortion or doing hysterectomy operation to a woman. So what we have seen, there is every chance of recurrence of bacterial vaginosis. Once you treat a woman, that woman usually comes for the second time or third time, and they used to say that I'm having these ailments repeatedly. What might be the cause and how it should be treated? Bacterial vaginosis recurrence rate 1 month after the therapy is 20 to 40%, so it's quite high. Recurrence may be a result of persistence of bacterial vaginosis, associated organisms, and failure of lactobacillus recolonization. Twice weekly metronidazole gel for 6 months may reduce recurrence, but it is a hectic treatment. So the key points to be kept in our mind is recurrence is very common. Treatment attempts to decrease anaerobes and allow lactobacilli to repopulate. No other approaches to enhancing recolonization of lactobacilli has been shown to be effective. And certain other therapy like OGAT therapy, exogenous lactobacillus treatment are also there. So the current treatment option for bacterial vaginosis is quite different from those days when we are practicing in 70s and 80s in the government hospital or in our clinic. Antibiotics and antifungal remains mainstay of therapy. The recurrence rate is high associated with side effects. So the name that is coming to our mind is the probiotics. Probiotics which contain lactobacillus used over a long period, an alternative to antibiotics, particularly within the context of high infection recurrence rate. Possibility of harnessing specific bacterial strains in order to prime the vaginal microbiota in the pre and periconceptual periods. So probiotic is the drug of choice for the new generation. So how can you define probiotics? According to World Health Organization, probiotics are defined as live microorganisms which, when administered in adequate amount, confer a health benefit on the host. But prebiotics or the probiotics, they must have the certain characteristics they must fulfill. So these are persistence in the human intestinal tract, clinically validated and documented health effect, antagonism against enteric pathogens, safety in food and clinical use, acid and bile stability will have to be there, and it must be have of human origin, production of antibacterial substances, and adherence to human intestinal cells. These are the characteristics of potential probiotics. Along with probiotics, there is prebiotic. Prebiotics are compounds in food that induce the growth of activity of beneficial microorganisms. Together, prebiotics and probiotics, they are called symbiotics. Then what does the probiotic they do? They stimulate the growth and reproduction of only useful microbiota, maintain the acid pH, remove excess mucus from the walls of the small intestines, reduce the formation of gases, suppress the reproduction in the intestines of pathogenic bacteria, stimulate peristalsis, improve the work of the digestive system. Vaginal probiotics rationally to develop. So we are using nowadays probiotics to many women who are suffering from bacterial vaginosis. So clear hypothesis about the role of lactobacilli. There is clearly established protective role of lactobacilli is definitely there. Lactobacilli predominant in the vagina. Application can be topical, reaching high inocula, no organoleptic considerations. So clinical trials that can be done very easily. There is easy sampling, easy re-isolation of probiotic lactobacilli after application, and it is already available in the market. So what are the rationale of probiotic that we use? Using lactobacilli, develop a non-chemotherapeutic probiotic therapy using lactobacilli to maintain healthy lactobacilli-dominated vaginal flora. So sexually transmitted diseases can be lowered, prevent preterm labor, good quality of life we can give to a woman, those who are suffering from the ailment. Then this can be inserted directly into the vagina. Oral preparations from gut to vagina is there. Used in women prone to urogenital infections during infection, but also for healthy women to maintain normal flora. So rationally of probiotic that we use in women prone to urogenital infections or during infection in healthy women when a prophylaxis to maintain the normal flora, and lactobacilli probiotic can be used over a long period without adverse effects, unlike antibiotic. So if you compare probiotics with antibiotics, antibiotics, they damage the commensal microflora, can increase the occurrence of resistant bacteria, can have adverse side effects. But in probiotics, we do not see all these things and can be used in exertion in adjunction to antibiotic to restore the commensal microflora too. So here in this slide that I can request the company people to aid commensal microflora along with microbiotics to some women so that they can be treated in that way. Ideal treatment for the bacterial vaginosis: provide Indian genome specific strains that we can put, and it is very much specific for the Indian women to get the genome specific strains for the treatment of bacterial vaginosis. Vaginal specific strains should be there, maximum colony formation units up to 10 billion CFU. So biological control of vaginosis to improve reproductive health. Here we can see from these data like human vaginal microbiota plays an important role in the maintenance of women's health, as well as of her partners and newborns. When this predominantly lactobacillus community is disrupted, decrease in abundance, and replaced by the different anaerobes, bacterial vaginosis may occur. In bacterial vaginosis, the overgrowth of anaerobes produces noxious substances like polyamines and other compounds that trigger the release of pro-inflammatory cytokines interleukin, IL-1 beta and 1 IL-8. Bacterial vaginosis can profoundly affect with different mechanisms all the phases of woman's life in relation to reproduction, before pregnancy, during fertilization, through and at the end of pregnancy. Bacterial vaginosis can directly affect the fertility of a woman. Since an ascending dissemination of the infection species may lead to tubal factors infertility too. So from the above points, you can say that exogenous strains of lactobacilli have been suggested as a means of re-establishing a normal healthy vaginal flora. So we must select the flora very selectively, and probiotic strains can eliminate bacterial BV and also exert an antiviral effect, thus reducing viral load and preventing fetal and neonatal infection. The administration of beneficial microorganisms, which are called probiotics, can aid recovery from the infection and restore the. It can restore the vaginal flora and it maintain it also. So, to do the summary answer, abnormal vaginal microbiota may be associated with poor reproductive outcomes. A prospective study of in vitro fertilization of the patients. In the summary, you can say the vaginal microbiota of in vitro fertilization patients can be characterized with qPCR test, which may be promising tools for diagnosing abnormal vaginal microbiota and for prediction of clinical pregnancy in IVF treatment. So limitations and reasons for the questions, although a total of 130 in vitro fertilization patients were included in the study, a large sample size is needed to draw firm conclusions regarding the possible adverse effect of abnormal vaginal microbiota in relation to the clinical pregnancy rate and the other reproductive outcome. Abnormal vaginal microbiota may negatively affect the clinical pregnancy rate in IVF patients if a negative correlation between abnormal vaginal microbiota and the clinical pregnancy rate is corroborated. Patients could be screened and subsequently treated for abnormal vaginal microbiota prior to fertility treatment. So whenever we consider the lactobacillus, it should be of native origin. And why should you go for the native origin of the lactobacillus strain? Because native origin products with strains of Western origin, which may not have the same benefit to the patients. It is now widely accepted that native strains will have better efficacy on the local population, and I do support it. Product should have the advantage that all the strains are of native origin with clinical study and safety validated in Indian population in establishing efficacy. What should be the right lactobacillus for the treatment? Lactobacillus crispatus, lactobacillus jensenii, lactobacillus gasseri, and lactobacillus iners. These are the main because from 43.3 to 20.8, the vaginal smears graded by gram stay normal, or in the other hand, we can disturb 37 from 7.4 to 27.9. There is these species of lactobacillus. They produce hydrogen peroxide. The first one, the middle to one, they give hydrogen peroxide 2 plus, and the last one, that is lactobacillus iners, it gives 1 plus. So other lactobacillus are also there that we can use definitely, but these 4 lactobacillus are of main importance. So we can see that treating bacterial vaginosis increases pregnancy rate. European Journal of Obstetrics and Gynecology and Reproductive Biology has proved that pregnancy rate is almost more than double in cases of bacterial vaginosis treated patients and bacterial vaginosis untreated cases. So treating bacterial vaginosis increases pregnancy rate. We can see the parents which are laughing when they get a newborn which they were expecting in their life. So vaginal microbiota and its relation to IVF outcomes. Altered vaginal microbiota and bacterial vaginosis may be related to the poor pregnancy outcome. Therefore, patients undergoing IVF should be screened and eventually treated to enhance the chances of success. It is seen that vaginal microbiota rich in lactobacillus without bacterial vaginosis, either clinical or subclinical, leads to more positive outcome with the pregnancy rate. Then prospective study of reproductive age women undergoing IVF and found the embryo implantation was less successful in a woman with reduced lactobacillus specific in their vaginal microbiota. In this slide, you can see the IVF outcome. When the IVF better outcome is there, when lactobacillus dominant microbiota is there in the vaginal secretion or fluid, IVF outcome is less where there is lower implantation. When there is lower implantation rate in IVF, increased number of miscarriages are there, decreased number of at-term pregnancies, and reduction of pregnancy rate. In these cases, high concentration of Gardnerella vaginalis and or Etopobium vaginalis and low abundance of lactobacilli are seen. CST-IV is most associated with negative ART outcome. Bacterial vaginosis or pyrotubed microbiota are also a common factor in fertility, preterm delivery, or miscarriages. CST-IV with or without a diagnosed bacterial vaginosis has been described a common feature of preterm birth in Caucasian women and African American women. Endometrial dysbiosis can be the cause of implantation failure and lead to infertility. A lactobacillus dominant endometrium is more receptive than an endometrium with high bacterial diversity and a low proportion of lactobacilli. The results of the study of Moreno et al. In 2016 highlighted that women with lactobacillus dominant microbiota have a higher rate. Hormonal fluctuations, especially in estrogen, are implicated in the regulation of vaginal microbiota and in preparation of the endometrium for implantation and pregnancy. It can be expected that hormones also influence the endometrial microbiota. So certain things about vaginal microbiota and its relationship to preterm birth. Just in a nutshell, I would like to pointed out that vaginal microbiota is important for the health of the whole reproductive tract and for prevention of pathological infections. It can be expected that it affects not only the pregnancy but also the delivery. The vaginal microbiome evolves during pregnancy in relation to gestational age and tends to lose the diversity observed in non-pregnant women. A non-bacillus lactobacillus dominant vaginal microbiota and increased bacterial diversity during pregnancy are associated with high risks of preterm birth. So increasing susceptibility to HIV infection that we have already discussed and we have seen. I do not like to go into details of it. So estrogen gut microbiome interactions exhibit physiological and clinical implications. So these are the points: dysbiosis, reduction in gut microbiome diversity, and reduced beta glucuronide activity results in decreased deconjunction of estrogen, phytogen into their circulation and active forms. The subsequent disease decrease in circulating estrogens alters estrogen receptor activation, and which might lead to hypoestrogenic pathogenesis or pathologies, obesity, metabolic syndrome, CVD, and cognitive decline. Hyperestrogenic pathologies can also be driven by the estrobolome through the increased abundance of beta glucuronide producing bacteria, which leads to elevate the levels of circulating estrogen to drive diseases such as endometriosis and cancer. Obesity and metabolic syndrome can impact their disease states in PCOS until then ultimately fertility. Intervention, bariatric surgery, metformin, and FMT provide therapeutic interventions that can mitigate the associated disease state through modulation of the gut microbiota composition. So before winding up, I would like to give some take-home messages or summary. In the summary, I would like to say vaginal secretions contain numerous microorganisms, and the host provides them nutrients for the growth and development. The dynamics of vaginal microbial communities over the physiological phase of a female's life gives an insight into the mutualistic relationship between the female host and the vaginal microbiota. Disruptions in vaginal association with the microbiomes lead to the change in the vaginal environment, which enhances the risks of acquiring diseases, including sexually transmitted diseases, bacterial vaginosis, fungal infections, preterm birth. More research on vaginal ecosystem will translate into better diagnostic and improved personalized treatments. I think scientists, they are in their studies, they are going to reveal many more things regarding vaginal microbiomes, their treatment strategies in near future, I hope. And I would like to thank all the participants for their patient hearing. And before concluding, I would like to thank the organizers of the cell company who has given me this opportunity to share my views and my something that can be said. I have concluded here with these words, and again, thanks to everybody.
Thank you, sir, so much for giving this important information regarding vaginal microbiota, that how important it is to maintain a healthy vaginal microbiota to prevent the various effects, long-term effects. So let me see if there is any questions in the comment section. So, sir, we have one question from Dr. Sudhamani. Does probiotics help in conception? Can we use probiotics along with antioxidants?
Yeah, definitely. So we can use antioxidants with probiotics. It might give good results for the infertile couple. Definitely, you can try it
And
uh, because most of the doctors, they are treating these infertile couple with probiotics, prebiotics, and antioxidants. Because nowadays it's a question whether the antioxidants they do have a role or not in the treating male or female infertile couples.
And sir, what are your thoughts about the uses of vaginal washes? Nowadays, there are lots of vaginal washes. So, does it maintain the pH of vagina?
Yeah, for douching and all, that's your question, I think. So better not to use all those drastic your vaginal washes, provided somebody is using for their order or something other reasons. Then we should have the counseling with the patients, and we can make them understand why it might be the cause of vaginal discharge or odor in the vagina or itching or something like that. So we can treat it by antibiotic, probiotic, prebiotic, and all.
Sir, one more question is regarding prebiotics. What is the role of prebiotic in chronic viral infections in HIV patients?
Yeah, in the HIV patient also, those who are suffering from HIV, the people they are also treating them with prebiotic, because most of the persons who are suffering from HIV, they do have all these immunosuppressive drugs they are also taking, so they do have your diarrhea, dysentery, and other all ailments. So we can treat them definitely with prebiotics.
And sir, can probiotics kill candida infection? Can help in reducing candida infection?
There is a chance, but if you are sure enough that the candida is there, definitely we can go for other treatment also.
So means it can be given with the combination with
Yeah, in the
antifungals.
combination that I have already told, that company
Yes.
should come up with the combination of some metronidazole or probiotics
Mhm.
or
Mhm.
tinidazole with probiotics, something like that. They can have the recharge on that, and they should come up.
So this can also help in the this can also help in the resistance which is happening against antibiotics. Probiotics can help this condition.
Yeah, definitely. So definitely, I hope in that way.
Hmm. So I cannot find any more questions in the comment section. Thank you, participants, for giving all these questions, and thank you all of you to be part of this webinar. And I also thank to Dr. Lalit Pura for giving this very important information on vaginal flora maintenance. And I also thank to our colleagues who made this webinar possible in Shield. And sir, we would like you to have more sessions with you in future. Thank you so
Yeah, I
much.
am looking forward. I am looking forward to have more sessions with SEAL.
Thank you, sir.
Okay.
Thank you, colleagues. And thank
Okay. Thanks
you,
and good night.
participants. Bye. Good night.
Good night.
Happy weekend.
Same to you.